triangle. That means the muscles are there. I'm showing again the midline one. So this is the symphysis menti. This is the hyoid bone. This is the thyroid cartilage, cricoid cartilage, then trachea. This tube is showing that it goes to the trachea. So this is the ring of the trachea here. Over this ring, this is the thyroid gland. Two lobe of thyroid gland. I am just holding by the forceps, and anteriorly isthmus of the thyroid gland is there. You just see here, I am holding inside this forceps three structure. This is one vein, artery, and the nerve in between. That means if I hold like this way, this is the vein, this is the artery, and this is the vagus nerve. Okay, so these three structure is very important structure, so needed on support. So the neck deep fascia will make a covering, it called the carotid sheath. It will cover it. This carotid sheath we are not seeing here, you will see in the book. But you see here, these structures will be covered by a deep fascia, tunnel-like structure. It's called the carotid sheath. So what are the structures? Common carotid artery, tunnel jugular vein, and this vagus nerve. Now I'll show you how can I recognize that this is the artery and this is the vein. You see, I'm just showing my finger. If I touch it, it is the very fresh cadaver. But if I touch it, its wall is a little bit thicker. And if I touch it, it has the inside clot. But the wall, if you touch, wall is thin. Inside clot is there. It's a very fresh cadaver. So the blood clot inside you are seeing. But if I touch by this finger, you see, the wall is thinner. But this wall is thicker. So we can differentiate which one is artery, which one is vein, and it is the blackish in color, blood clot already there. And you see this, the whitish color one, this is the vagus nerve. So this vagus nerve is the, you know very well, this is the 10 cranial nerve, it has to go inside the thorax. Because you have already done the heart and lung, you know that it will give the parasympathetic supply to the respiratory system, cardiovascular system, then it will go to the abdomen also. So these three structure already we have got here, and laterally external jugular vein, another vein is there, that is the superficial vein. Internal jugular vein actually coming from the brain, then it is draining to the actually it is making the brachiocephalic vein along with the subclavian vein. So and this is the external jugular vein you are seeing. It is draining the superficial structure of the face. So all superficial venous drainage of the face and neck is taken by this external jugular vein. Brachial plexus structures I am seeing. You see here. This, just follow my forceps. This is the brachial plexus. That means the nerve plexus that is giving supply to the upper limb. Here the brachial plexus structures we are seeing. So this is the regarding the neck. So what the important structures we are seeing? I would like to make a summary again. First you focus here. You see this is the symphysis menti. You can see a little bit down. This is the symphysis menti, and this is the suprasternal notch. Until this is the neck extension anteriorly. So if we cut it, what thing we cut? What thing made the roof? This is structure. What the content here? Skin, then superficial fascia, one muscle here blended inside. These are the fiber we are seeing, platysma muscle. Then we are getting the deep fascia. We cut and we flap laterally. Then we are getting the midline structure, symphysis menti. These are the suprahyoid group of muscle that are making the floor of the mouth. Our floor of the mouth is making by this muscle. Then we are getting here hyoid bone, just here. This is the hyoid bone. Then after that we are getting one membrane-like structure that is connecting the hyoid bone with the thyroid cartilage. It's called the thyrohyoid membrane. And this one we are getting, this one is the thyroid cartilage. It makes the Adam's apple for the male. And after that, if we touch here, we are getting cricoid cartilage. After that, we are getting the rings of trachea, very well, rings of trachea. So, these are the midline very vital structures. And on each side also vital structure, mainly here the carotid triangle. You see internal jugular vein, vagus nerve, common carotid artery and its two branches. If we go up, we will be seeing its two branches and its bifurcation. Yes, we got here two branches. Okay. So, this is the common carotid artery, vagus nerve, internal jugular vein. And superficially another vein we are seeing, this is the external jugular vein. And this supraclavicular triangle here, we are seeing the few cords of the brachial plexus. So, this is what showing here in the neck. So, in this plastinated specimen, again one review. This is the sternocleidomastoid muscle, this is the trapezius, this is the clavicle, the superior nuchal line, this is posterior triangle. What thing we are getting here mainly? Spinal root of accessory nerve we are getting. Then we are getting subclavian vessels and subclavian, that means subclavian artery and subclavian vein, and we are getting the trunks of the brachial plexus. And this is the anterior triangle is showing here. Anterior triangle, here is the muscular triangle, here is the carotid triangle. This one is the submandibular, that means the digastric triangle. This is the submandibular gland. This is the facial artery. Okay. And this side, very clearly you can see the structures. This is the common carotid artery. It's two branch. External is laterally, internal is medially. So, internal carotid artery, external carotid artery, this is the common carotid artery. This is the vagus nerve. Internal jugular vein we are not seeing here, but very clearly we shown in the space cadaver. And these few, the cervical spinal nerves we are seeing that are giving supply to the neck. The muscles, the joints, those areas. This is the submandibular gland, this is the irregular facial artery, this is the parotid gland. So, thank you very much.